Hello! This video is a follow-up to my previous video which described the anatomy of the aortic arch and its branches. At least some degree of variation in the textbook structure of the aortic and subclavian vessels, as depicted in my previous video, is to be expected in almost all patients. There is a wide range of differences between people in terms of the structure of the aortic arch, and some of these will be covered in this video. One basic example of such variation is the absence of a brachiocephalic trunk, which is seen in around 1 in 40 people. Conversely, 1% of people have a brachiocephalic trunk on both the left and right sides. The impact of both of these variations on the patient is minimal. More clinically significant pathologies can also develop. One very important variation found in between 7 to 25% of people is colloquially termed a bovine arch. In these cases, the left common carotid artery does not come off the arch of the aorta, but instead arises from the brachiocephalic trunk. Although this is usually asymptomatic, the artery can be vulnerable in the context of invasive procedures that involve the tracheal rings or the cricothyroid ligament. A final key example is the aberrant right subclavian artery, which is also termed arteria lusoria. This is estimated to affect around 2% of people and is characterized by the absence of a brachiocephalic trunk providing the right subclavian artery. The subclavian artery instead arises from the distal aspect of the arch of the aorta as a fourth branch. It must cross back towards the right side of the body and does so via various routes. Typically, it passes posterior to the esophagus and can result in symptoms of tracheoesophageal obstruction. Dysphagia and wheezing are the most common symptoms and are seen in about 10% of people with this variation. In summary, I have covered the common variations affecting the arch of the aorta. Thank you for watching. Please like, subscribe and leave a comment for feedback on how I can improve future videos. Also, feel free to put down any questions that you may have and I will respond to them as soon as I can. Thank you.